Welcome back. So I'm Dr. Das here. So today I'm going to talk about why stroke happens. Why and how does clot go into the brain and cause stroke? So as we're discussing that there are two types of stroke. One is stroke which happens because of clot going into the brain and it's occluding, it's obstructing an artery, and thereby the brain is not getting the blood supply. And another way of getting a stroke is the blood vessels got ruptured, right? So there is a bleeding into the brain. So why there is a clot formation and how the clot reach into the brain? How the clot reach into the brain is a very simple thing, because we have the two major artery here which carries the blood into the brain. In front, two arteries, and in the back side there are two arteries which goes into the brain and they are connected with each other. So anywhere in their path, if there is a clot, that can go into the brain, or either from the heart also they can go. The most important question comes is how the clot is formed. So the question is how this clot are formed, and for that I just I'll come to few of the causes how it happens actually. As I said, we have two major vessels which supply our brain. We have two vessels in front and two vessels backside. So over the time what happens that in the wall of this artery there are some cholesterol deposits can happen if somebody is having cholesterol, high cholesterol or some other factors. So that cholesterol get deposited there, and because of some causes, what happens that when the cholesterol get started deposited, supposedly the artery is so much of thick and the lumen is like this one, and over the time it becomes small, right? And what happened that because of some cause, this cholesterol the plaque can get dislodged, and that clot can go into the brain and obstruct some artery and giving rise to stroke. That is one common cause, right? Similarly, what happened that clot can reach from heart actually. So it's very strange to when you come to know that from heart the clot is going into the brain. How it does happen? What happened? The main function of the heart is what? It's the pumping the blood, and it's pumping the blood so that blood reach each and every part of our body, right? So sometimes what happened, the heart is not pumping in a proper way, right? So the pumping power of the heart has reduced. That in medical terms, we say like DCMP. So like we have ejection fraction is like around 70%, 60%, that is reduced to like 15-20%. So the blood is getting actually not going outside, it is getting stagnant here, and over the time that give rise to some clot formation there, and this clot can go into the brain, right? Another way is like that the heart should pump in a regular way, the beat should come in a regular way. Because of some causes, this regularity may be disturbed, which in medical terms we say is atrial fibrillations. That means the heart is pumping, then stopping in between, then again pumping and starting. So it is irregularly pumping. So doing so, what does happen that the heart is not pumping in a regular way, giving rise to some clot formation within the heart itself, right? So that clot formation sometimes get dislodged from the wall of the heart, and then this clot goes into the brain, right, and giving rise to stroke. Okay, so when this clot go into the brain, they obstruct, they occlude the artery, and some part of the brain is not getting blood supply, and this can give rise to stroke in the form like not able to lift hands or legs, weakness in your speech not becoming clear, slurred speech, the facial deviation, the person become unconscious. But these all things happens suddenly, not like over days or something like that. Because when a clot goes, suddenly it obstructs blood supply to the brain, that part of the brain is not getting blood supply. So instantly the symptoms starts coming, right? So these are the two things where this clot formation happens and goes into the brain. So I'll come to the other cause which are associated with giving rise to clot formations, and there is tendency of getting the blood become more thicker, the viscosity of the blood getting more thicker. So what happens that when the blood becomes more thick, there is more chances of getting clot formations, and this can happen in person who are having very chain smokers, can give rise to tendency of more clot formations. They can have tendency of atherosclerotic disease, the cholesterol plaques can deposit. person who are having diabetes, person who are having hypertension, so can give rise to this atherosclerotic disease or cholesterol deposits in the vessel wall. Similarly, something like obesity and stress, these are the things which are found to have been contributing factors in causing stroke actually. So this is important. This is because recently in current times we are seeing lots of young person, you wouldn't believe, in their 20s 30s they are having a stroke. And where in general, like somebody is doing like in 20s and 30s, they don't go for checking their health checkup, and suddenly they develop a stroke. This is one of the cause, or few causes is like this one: the sedentary lifestyle, obesity. This all contribute to this high cholesterol, or which can give rise to clot formations and giving rise to stroke actually. And there are some genetic causes as well, where the as I said, the blood becomes more thick and giving rise to stroke, but that causes are very less actually. So these are these are the main causes how the clot formation happens. And in my next video I will be talking about how to prevent this clot formation actually, and also in next video we will be talking about in stroke which happens because of bleeding and why bleeding happens in the brain actually.